I'm Dr. Babak Sharif Kashani, and I'm a heart failure cardiologist from Masih Daneshvari Hospital, Tehran. And today I'm going to be talking about heart failure and diabetes. Um, we know that diabetes does affect the heart in different ways. We have a scheme here that shows that diabetes can involve the heart through the autonomic system, also through inflammation causing hypertension, fibrosis, diastolic or systolic dysfunction, and leading at the end to diabetic heart failure. This is a syndrome that could be caused by ischemia, and you can see that there are three mechanisms to induce ischemia that diabetes does use all three mechanisms. We have the atherosclerotic disease that is more common in diabetic patients than in other groups. Also, we have the vasospastic disease, as well as the microcirculation, that when microcirculation involvement is seen in diabetic patients, we might even have heart failure without having the uh, common symptoms of ischemic disease. So in this regard, diabetes is one of those diseases that could involve the heart through many different pathways. We know that the prevalence of heart failure is higher in patients who have diabetes mellitus. 1% increase in the glycosylated hemoglobin could cause an 8% increase in heart failure, which is a very large number. Even if they are not diagnosed as diabetic, they might have cardiovascular disease before being diagnosed. And in those patients who do not have diabetes but have insulin resistance, we do see a higher increased number of patients with heart failure, suggesting that insulin resistance could be a cause of heart failure in these patients. In a study by Hoffner, the 7-year risk of myocardial infarction is equal in patients who have diabetes mellitus and on those who have prior myocardial infarction. So actually diabetes is not the risk factor, but a CV disease risk equivalent. And this is very important. We're not facing a kind of risk factor. It is actually atherosclerotic and non-atherosclerotic disease. And patients with diabetes are just as in danger as those who have had a previous myocardial infarction. Knowing all these points, most patients with diabetes or with multiple risk factors don't reach their treatment goals. In this study that was published in 2010, nearly half of the patients didn't meet the targets for glycemic, blood pressure, or cholesterol control. And only 14% of them had the three targets in these measures. So we were not treating them as well as we should. Looking at the medications that we have for anti-diabetic treatments, you could see that it started from human insulin, the sulfonylureas, and then metformin. But now in the recent years, we have had a lot of other medications added to this list of therapies. And if you look at this slide, you could see many of these medications. I'm not going to go through this slide, but all these medications should be considered when we are trying to treat these patients with respect to their effect on the cardiovascular system. Some of them could increase symptoms of heart failure. Some of them could prevent myocardial involvements. But in talking about heart failure, we usually look at the SGLT2 inhibitors, which I'll be talking about later. These are a few studies about anti-diabetic medications in heart failure and heart disease, not only heart failure. And during these years, we have been trying to see if, first of all, these medications are not non-inferior to not treating patients, and then trying to point out which of these medications can cause a better prognosis for patients with diabetes. And recently, the last studies that we see in the year 2020 have been published. They are not, some of them are included in my slides, but Interestingly, we see that these medications, especially the SGLT2s, are showing great benefits for patients with heart failure in diabetics and also in non-diabetics. This is a slide showing the effects of different studies on medications in heart failure patients. And although most medications are nearly in the midline, but SGLT2s are showing quite a favorable effect for heart failure. And this is the point that I'm trying to get to, that talking about cardiovascular disease and talking about the effects on atherosclerosis is different from talking about heart failure. Different classes of these medications. We have the DPP4s, and these medications, including linagliptin and sitagliptin, that we see in many medications used for diabetes these days, do not increase the events of acute atherosclerotic events, but because some of them could cause a worsening of heart failure, they are not used in patients who have heart failure. The GLP-1 receptor agonists also have had a very good effect on acute coronary events, but still none of them have shown to reduce the risk of hospitalizations for heart failure in patients with diabetes. So if we are going to treat these patients for heart failure alone, perhaps these are not the first choice that we should have. But on the other hand, the SGLT2 inhibitors, including dapagliflozin, empagliflozin, and other medications, have shown the reduction of MACE, the reduction in cardiovascular mortality, a reduction in all-cause mortality, and most importantly, positive effects on hospitalization and also mortality in patients with heart failure. So looking at these kind of medications, these group of medications are the ones that we want to use in patients with heart failure. The EMPA-REG and the CANVAS trials both showed that these are superior when compared with not treating the patients with these medications. There were slight differences. For example, empagliflozin was a little bit better in Asian subjects, and there were some different kinds of complications. For example, a slight increase in lower extremity amputation was seen with canagliflozin, but altogether, the SGLT2s had a very good profile when they were used in patients with heart failure. Having said all of these, regarding the morbidity and the mortality rates of diabetes mellitus and chronic heart failure, which are very high, and the impact of diabetes on heart failure, when treating these diseases, we have to have a teamwork to use those medications that can cause a benefit on the prognosis of these diseases. So SGLT2s should be introduced to the group of medications used for these patients. And we should also be aware of the shortcomings and the complications that these medications can cause, but altogether they are medications that have changed the way that we look at diabetes mellitus in heart failure. Interestingly, these group of medications, the SGLT2 inhibitors, have been effective also in patients with heart failure who are non-diabetic. And because of the time that I've got, I think this is all that I could say. Thank you for your time. And if there's any question, I'll be listening for them. Thank you.